Torque is twisting force to an object. Long time ago, we used the term of spasticity to describe the increased muscle tone. Now, torque is the final sum of forces which is impacted on bone and joints during growth. This is torque. This is torque. Also this one, mixed hypertonia. Please. This is what we see. It's mixed hypertonia. Spasticity with dystonia leads to scoliosis, deformity, patient complaining pain, his severe spasm. The next slide, next slide. No, next slide, not video. Without a proper management, without a proper management of spastic cerebral palsy, it will be a result of severe deformities and will affect the quality of life. What's a proper management for spastic cerebral palsy? To practice evidence-based medicine, physicians must integrate a clinical experience with the best available evidence from systematic research. What's the level of evidence of treatment of hypertonia in cerebral palsy? This is a systematic review of intervention for children with cerebral palsy. 166 articles meet the inclusion criteria. Interventions seeking 131 outcomes. 16% were graded do it. Do it means have high evidence. This one, all of these interventions have high evidence for treatment of cerebral palsy. The number one is tone controlling procedure, botulinum toxin, diazepam, and rhizotomy. And there's casting for improving and hip surveillance. The last one is pressure care, bisphosphonates, and anticonvulsions. Okay, what's the level of evidence? Talking about timing of orthopedic intervention. Actually, this article presents classification of lower limb musculoskeletal pathology. The classification aims to improve communication and to guide referral for interventions, which, if timed appropriately, maybe optimize long-term musculoskeletal health and function. A 4 stages classification system was developed. Stage 1, hypertonia, from birth up to about 7 years. Stage 2, contracture, from about 6 years up to 8 or 9 years. Stage of bony deformity, from 9 to 11 or 12 years. After that, stage of decompression. Stage 1 need tone management, stage 2 contracture surgery, stage 3 bony surgery, and stage 3 salvage surgery. Why early orthopedic intervention for management of hypertonia, it lead to non-function of Golgi tendon. Non-function Golgi tendon lead more inhibition of stretch reflex, which lead to more hypertonia. More hypertonia leads to muscle spasm and shortening. Comprehensive clinical examination for cerebral patient and assessment is crucial. Why? Because decision is more important than incision. The goals of neurosurgical management for spastic cerebral palsy. Number one, improvement of motor function. That means early management of hypertonia, it will lead to improve of walking ability and gait performance. Early management of hypertonia lead to prevention of contractures and hip dislocation, as well as the reduction of pain. Early management of hypertonia leads to improve caregiving, sitting balance, or transfer. Treatment modalities. There is a lot of treatment modalities. First of them, oral medical agent, physical therapy, botulinum toxin, and neurosurgical treatment for spasticity, selective peripheral neurotomy, and selective dorsal rhizotomy, combined anterior-posterior rhizotomy, and intrathecal baclofen therapy. I will concentrate on selective dorsal rhizotomy. In selective dorsal rhizotomy, we select the dorsal root by using of intraoperative neurophysiology monitoring. We select the root and making rhizotomy according bar criteria. We will not discuss the technique of rhizotomy. I will discuss the first case. This 4 years boy, CB spastic quadriplegic, gross motor 4, unable to maintain balance, unable to maintain alignment, which we choose to do for physiotherapy for 1 year. After that, we discuss with family to do rhizotomy. After rhizotomy, 6 months post-lumbar rhizotomy, there is improvement of walking ability, improvement of gait performance. The patient from gross motor 4 to gross motor 2. Case number 2, 5 years old girl, CB spastic diplegic, gross motor 4, unable to maintain a ligament. After rhizotomy, 6 months, improvement of motor function. Repeat, please. Repeat the video. As we see here, she can't use, after 6 months, improve motor function, improve walking ability and gait performance. And she's happy post-surgery. The next video, 16 years old boy, CB spastic quadriplegic, gross motor 4, inability to maintain anti-gravity head and trunk posture, inability to control arm. After rhizotomy, by 6 months, the walking using a mobility device, improvement of motor function and gait performance. By the way, all the cases without orthopedic management. Before lumbar rhizotomy, this one have many times do soft tissue release and the spastic muscle regain. Okay, the fourth video. 9 years old girl, CB mixed hypertonia, gross motor 4, severe hypertonia, limitation in mobility, all motor function are limited. The patient complaining pain and crying every time. After 2 weeks of lumbar rhizotomy, improve caregiving, reduction of spastic pain. As we see here, the girl happy. Okay, خلاص. Take home message. Don't stand alone in front of hypertonia. Don't stand alone. That means you have to discuss with other colleagues, with orthopedic, with a neuropediatric, with dietitian. Rhizotomy is effective on controlling of spasticity. Early referral of the patient will improve motor function. Multidisciplinary management is a must. Thank you all for attention.
Good morning. It's a complete